With no vaccine, no cure for coronavirus, the push for more testing is growing, especially for antibody testing, which can reveal if someone had the virus and then recovered. But as News 5's Tanisha Cordell explains, one doctor says those tests should be reserved for those exposed to the virus the most because they could provide important information about how it's spreading.
University Hospital's chief of clinical pathology says testing large amounts of people not likely infected with coronavirus could exploit antibody testing, causing false positive results. It's why they're first calling on medical professionals and first responders for its antibody study. The fear is still there, but some first responders have somewhat mastered coping with that fear of COVID-19.
You push it back so that you can maintain your mission.
The fear of unknowingly carrying the virus is hard to ignore. No one on his team has tested positive, but Parma firefighter and department spokesperson TJ Martin says it would be comforting to know for sure.
I'm pretty confident that when we do get tested, a lot of first responders throughout the country are going to come back testing positive for COVID-19.
With testing still limited, Dr. Christine Schmatzer with University Hospital says antibody testing will help determine if someone has ever been infected with COVID-19, which could help confirm if they were asymptomatic.
There's a certain set of people, a percentage of the population that even though they have the disease, that typical test can be negative.
Her team currently fine-tuning a study to test 10,000 frontline workers, including the Parma Fire Department, which received a letter asking for volunteers. The goal to better understand the spread of the virus, but to also determine if immunity against the disease exists.
What we still don't know is whether having an antibody gives any indication of whether you are immune or protected from getting that disease again.
The results won't change the importance of social distancing and wearing protective equipment, but Martin says participating in the study will relieve some of his team's fears as they continue protecting their community. UH hopes to begin its antibody study in the coming weeks. Right now, I'm told there's no concern surrounding the accessibility of antibody testing, but Dr. Schmalzer says they can't guarantee there won't be any shortages. Reporting in Cleveland, Tanisha Cordell, News 5.